PRP may well be the most misunderstood treatment that we have here. Okay, some people think it's a miracle. Some people think it's expensive snake oil. It is neither. Let me tell you what it actually is. Hey, I'm Dr. Fawole at Ivie Health here in Syracuse, New York. And this video is specifically about PRP for joint pain, how it works, what the procedure looks like, the timeline, who tends to respond well, because if you've been Googling PRP and getting a mix of glowing testimonials and skeptical articles, this, my dear, is the plain English version. Okay. All right. So, PRP, what exactly is PRP? PRP stands for platelet-rich plasma. Let me break it down. Your blood has several components. You may remember this from like ninth grade biology, right? You've got your red blood cells, your white blood cells, um, plasma, and then you have your platelets, okay? Platelets are the ones we care about here. So platelets are the small little, I'll say fragments, right? That rush to a site of injury. So let's say you hurt yourself, they're almost like the first responders, right? I almost kind of picture them as like little like, you know, first responders that run to the site of the injury and then they start to send out signals. They start to put out those little flares like, hey, this is where the injury is. Okay. And those are growth factors. Growth factors are the signals that tell the surrounding tissue, hey guys, start to heal right here. And so what we do with the PRP procedure is that we get those plates and we concentrate them. So basically, we draw a small sample of your blood, we put it into a centrifuge, spin it down, and then what that does is that it separates the parts of the blood. So you have the red blood cells, white blood cells, and then the platelets get into one layer. And so we take that layer of platelets, we put it into the joint or into that spot that we're trying to heal. Now, you may have heard of PRP for joints. You may see PRP with like, vampire facials, hair rejuvenation, eye treatments and things like that. So yes, PRP is used in different things in medicine, in regenerative medicine. But today, let's talk a little bit about the joint part. So the thing about PRP and the world and kind of the messaging you see out there is that not all PRP is the same, right? There are different companies that make different kits, and people have different ways of preparing it because the quality of the spin matters. The way the PRP is prepared matters. And so, in some cases, and for some things, a single spin PRP will probably be okay. Or, you see double spin, you see different. And the literature is very mixed because of how people vary in how they produce their PRP. But let's just kind of settle in and talk a little bit about what happens when you come in through the door. The first thing we do is that we have a conversation. We want to understand, your history, your imaging, your symptoms, your goals. If it's even right for you, we tell you, right? If you're a candidate. And if you are, then we draw blood from your arm, like I said. We put in the centrifuge, like I mentioned. It spins for several minutes. We prepare the concentrated PRP, inject it into the joint. Now, we use ultrasound so that we know that it's going exactly where it needs to go. We're not guessing based on landmarks. We are putting it exactly where we want it, injecting it directly into the joint or whatever other procedure that we're doing. And the whole visit from start to finish, typically 45 minutes to an hour. And most of that is really just the time to kind of prepare the blood. If you drive yourself home, it's okay. You can return to your normal activity. We just ask you to avoid strenuous exercise for a few days while the joint settles. Most people are surprised at how straightforward this is, okay? Now, this is the part that matters most. Let's talk a little bit about the timeline. PRP is not like cortisone shots that you feel, relief in like one day or two. PRP works differently because the growth factors that we're injecting into the joint, they start a biological process, and that process, my dear, takes time. In the first 1 to 2 weeks, you may be like, "Oh my gosh, what did I do? Like that, nothing happened, right?" Yeah, and I understand that, okay? Some people may even feel mild soreness where we injected. That's the tissue responding. But as time goes on, they start to notice, oh, wait a minute. I can move my arm a little more, or I can move my knee a little better. Oh, I'm not as stiff as I used to. Oh my goodness, my range is a little better. Um, but the significant changes, I'll say, typically happen between weeks 8 and 12. And I like to make sure everybody knows this before we start, because the number one reason people think PRP didn't work is that they stop waiting too soon, right? They've said like a, like a rapid, like say like a cortisone shot response from a completely different mechanism. Now, if you know this going to the timeline, though, you're much less likely to be disappointed. Now, the difference, though, between PRP and cortisone, first of all, is that with cortisone, there's actually, evidence that you can't do it so often because it does degrade the joint over time. But anyway, that's aside. But with PRP, the while it may take you a little longer to feel that drop in pain, that is more sustained over time. Now, do you want to, rapid instant fix that goes away after a few weeks, or you want something that is more sustained over time? Now, who responds well, who does not? Not everyone responds completely to PRP, and not everyone is a candidate. Who tends to do well? I'll say people with early to moderate osteoarthritis, for example, people whose cartilage is a little, eroded but not gone. People who have had, let's just say, they've had some cortisone work, but then it keeps wearing off. Active adults who want to maintain function and avoid surgery. Now, people who may not do well with PRP, I'll say people with severe end-stage arthritis where the cartilage is like gone, kind of need something to work with. If there's nothing left to repair, the growth factors don't really have a target. So we look at your imaging and then we talk about treatment. And if we don't think you're a good candidate, you know what, we say so. And that's part of the conversation. It's not an afterthought. All right. So that's basically, PRP for joint in plain language. If you want to understand how like other things like say A2M or how PRP compares to cortisone and knee replacement, I made other videos for those and you can watch those. If you are in central New York or you want to fly in, we do have an airport. It is SYR, accessible from any of the major airports. Hop on in. Let's book a consultation. Let's talk. And hopefully get to see you. So, hey, I'm Dr. Fawole. If you know someone that could benefit from this information, feel free to send this to them, and I will see you on the next one.